Equity and Aging Services, looking 3 years back and 30 years forward. We'll be doing just what the title describes by providing first a sort of retrospective on the last 3 years of work completed by the Older Adults Equity Collaborative, or the OAEC, as you'll hear it today. And second, with your help and input, a bit of a perspective exercise on how all of us as members of the Aging Services Network can imagine the future of equity in aging services. So we have a lot to pack in for today's presentation, so I want to quickly address some housekeeping needs. As you can see, we opted to host this event in a meeting format instead of a webinar format. We did this to maximize the opportunity for people to engage with each other, the speakers, and the content. What that also means is that there's many opportunities for extraneous noise and feedback and disruptions. So we ask that you please do your best to remain on mute, definitely for the first portion of today's event. There'll be plenty of opportunity to get actively engaged in the latter portion of the event. If you happen to slip off of mute, it's very likely that one of our co-hosts will simply mute your microphone for you. We encourage you to drop any questions or comments, observations into the chat box. While we may not be able to address every item that makes its way into the chat box, we encourage any conversation that can enrich this topic today for everyone. Other than that, let's move ahead and take a peek at the agenda. Next slide. All right, so we'll hear in just a moment from Edwin Walker, Deputy Assistant Secretary on Aging at the Administration for Community Living. We're delighted to have Edwin join us today and kind of set the stage for us on this topic of equity and aging. Following that, we'll provide a quick overview on the OAEC and generally speaking, what we've been up to over these last 3 years. Next, we'll have an opportunity to meet each of the member organizations that comprise the OAEC. And finally, this is where all of you come in. We'll engage in an open dialogue and some breakout groups on the ways in which the Aging Services Network can continue to push for a better, more equitable America for older adults. We'll explore this by examining policy, research, and practice perspectives of this work. And we'll be wrapping up no later than 4:15 Eastern Standard Time. Next slide. So I'd like to first introduce Edwin Walker. As Deputy Assistant Secretary for Aging, Edwin Walker leads the Administration on Aging and advocating on behalf of older adults. In this capacity, he guides and promotes the development of home and community-based long-term care programs, policies, and services designed to afford older people and their caregivers the ability to age with dignity and independence, and have a broad array of options available for an enhanced quality of life. This includes the promotion and implementation of evidence-based prevention interventions, proven effective in avoiding or delaying the onset of chronic disease and illness. So Edwin, thank you so much. The floor is all yours.
Well, thank you so very much, and welcome to everyone. Thank you for joining us today. I am so pleased to be opening today's webinar because the topic is so critical, and our speakers, who are our partners in equity, are really quite incredible. I really applaud each of their efforts in designing and developing tools and resources for you, the Aging Services Network, to enhance your ability to achieve our collective goals, those of the Older Americans Act, those of the Biden-Harris administration, and those of our older Americans. And in fact, I mean all older Americans. It's what they deserve. It's especially those who have a history of difficulty accessing or a lack of access to vital services and supports, and the ability to enhance their lives. At the Administration for Community Living, we've created the Older Adult Equity Collaborative to provide technical assistance related to achieving the goals of greater equity. Our current collaborative grantees have worked together to enhance access and reduce health disparities among racial, ethnic, and other minority older individuals. Each member of the collaborative, the National Minority Aging Technical Assistance and Resource Centers, supports the President's executive order to advance racial equity and support for underserved communities. These resource centers design and disseminate frontline health promotion and disease prevention information that's culturally and linguistically appropriate for older individuals of African American, Hispanic, Asian American and Pacific Islander descent, including Native Hawaiians, American Indian and Alaskan Native elders, as well as older lesbian, gay, bisexual, and transgender adults. And they provide targeted technical assistance and training to the Aging Services Network, to older adults themselves, and to their caregivers. A few examples of the products produced by the collaborative members include the Resource Library Hub that houses a wide range of diverse topics from emergency planning, healthcare, housing and long-term care, cultural competency, and social isolation. An equity checklist for organizations to see how effectively they are in serving and supporting communities of greatest need. Numerous infographics and webinars focused on health and COVID-19 that are really tailored for racial and ethnic minority seniors. Multiple bilingual webinars, bi-monthly technical assistance chats, a numerous blog posts and learning collaboratives for English and Spanish-speaking older adults and caregivers, a multi-language call center program aimed to serve Asian American Pacific Islander older adults with limited English proficiency on topics such as Medicare and Social Security, as well as providing general information and assistance. Various certificate training courses and toolkits for the Aging Network on working with diverse older adults in the LGBTQ+ community, and a culturally appropriate manual, a toolkit for American Indian and Alaskan Natives on people with disabilities and working with tribes. We see our resource centers as a vital part of the Aging Services Network that are designed to help expand and increase equity, services, and access for communities and populations in greatest need. Today's webinar affords time to discuss just some of the amazing tools created by the Older Adult Equity Collaborative and to take a deeper dive into the future of achieving greater equity in the Aging Network. So again, thank you for joining us today, but more importantly, thank you for what you do each and every day on behalf of America's older adults. Thanks again. Have a great webinar.
All right, thank you so much, Edwin. Really appreciate that. Beautifully put. We'll move on to our next slide. So I'd like to pass it over to my colleague, the director of the Center for Healthy Aging at the New York Academy of Medicine, Ilana Kiefer, who's going to provide a brief orientation to the OAEC. The floor is yours, Ilana.
Thank you. How's my sound? Can you hear me okay?
Crystal clear.
Beautiful. All right. It's so lovely to see so many faces and or Zoom boxes on the screen. So thank you all for being here. Thank you, Edwin, for speaking and for being here and for making this all possible. And of course, to Mario for running the whole show. So I just want to give you a very brief overview of the Older Adults Equity Collaborative. This is part of a 3-year grant from ACL. And you can see here in our icon, the 6 different nonprofit organizations across the country that make up this collaborative. And the mission and the purpose of this collaborative is listed on this slide. And broadly speaking, we are all here to reduce or eliminate health disparities among minority aging populations and the caregiving populations as well. Also to ensure that all of the different information that we are all providing within the aging services community is both culturally and linguistically relevant and appropriate. Also to make sure that the Aging Services Network and other relevant stakeholders are receiving the technical assistance and the training that they need in order to provide the best type of services to the most number of older adults, and to ensure that all the work that we're doing and the best practices that we're developing and the resources that we're creating are shared among not only our organizations, which you'll hear more about shortly, but throughout really the country, as well as including other ACL funded resource centers that are doing related work in the aging and disability communities. So next slide. So you can see this webinar is one of many webinars that we have done over the past 3 years to get get the work out there, get the message out there, and get the resources out there. Most importantly, we were very lucky early on in the grant cycle to present to the Raise Family Caregiving Advisory Council to inform their strategy and ACL strategy, as you can see here on the left, on supporting family caregivers. And so all of the technical assistance resource centers presented to that council to make sure that this advisory council was keeping different minority populations in mind when developing that strategy. In addition, we presented at many different local and national organizations. This is just a small list of who we presented at. And if you like what you see today and you want us to present to your organization, just drop us a chat and we are more than happy to do that as well. Next slide. So Edwin had mentioned all these different resources that we have collectively developed and collated together. And this is really kind of our key tool that we have as a collaborative. It's called the Older Adults Equity Collaborative Resource Library. It is a free, publicly available, and constantly growing library that's hosted on the New York Academy of Medicine website. And as you can see here, the resources are organized by different categories that relate to older adults and caregivers. And then all of the resources within those categories are specifically keeping minority populations in mind. Most of the resources are developed by the TARCs that you're going to hear from today, but we are always growing the library. So if you have resources that you find are not here that you would like us to include, we hope that you will email us as well with that information. Next slide. So this is just kind of a snapshot of our cultural competency category. So you can see here just a smattering of the resources that you can find that specifically relate to cultural competency. The resources include toolkits, articles, presentations, and the like. Next slide. So the last thing I want to talk to you about today, which Edwin also mentioned, is our equity checklist. So one of the things that we found as a collaborative is that different organizations, including all of the organizations that are presenting to you today, wanted to make sure that do an inside look to make sure that the work that we are doing that we're walking the walk instead of just talking the talk when it comes to equity. So we developed collectively this assessment checklist, and it's not based on scoring or anything like that, but it's really just a way to kind of keep one's organization in check, to really kind of better understand how one is doing and how one is doing as an organization as relates to equity in many different ways, that relating to the work that one does as an organization, both internally in terms of who's at the table working at the organizations, what are the types of materials that we're producing, what are our policies, how are we collecting the data? What type of data are we collecting? What type of outreach are we doing? How many languages are we providing our materials and services in the languages in the communities that we serve? And how are we doing in terms of cultural competency? So you can see that this kind of checklist is really an opportunity for conversation. So that you, if you are working in the Aging Services Network or really any organization, can really have some guiding questions to have conversations about these different topics. So this checklist is also available in our resource library. We have presented this and will continue to at different conferences. And we hope that you'll use this as, again, just a way to really take a look at yourself and your organization and the work that you're doing in the communities that you serve. So with that, I will turn it back over to Mario.
All right, thank you so much, Ilana. So for our next section, we're going to take a moment to meet each of the individual TARCs. Each presenter will be kicking things off with a question, either a poll question that'll pop up or an open-ended chat box question that we encourage you to respond to. And we'll then follow with an overview of the work that particular TARC does, and highlight one of the resources of theirs that can be found in our OAEC resource library. So I'd like to first introduce Monica Calderon, who will kick it off with MHP Salud. Next slide.
Hello, everyone, and thank you very much for allowing me to be here today to share on our organization. And as you can see, our question just launched. Are you familiar with the community health worker profession, the CHW profession? Please feel free to answer yes or no. And while we go ahead and wait for the responses, I'd like to go ahead and start sharing on who MHP Salud is. Okay, so we serve communities by embracing the strengths and experiences of individuals and families, engaging them to achieve health and well-being. And the reason that we shared this particular question is because our organization is centered and works with the community health worker model. We support organizations that work with community health workers. We are an organization that is composed mostly of community health workers. So I do see that as the responses, most of you are familiar with community health workers. Another information that I'd love to share is just give you that insight on how we do what we do. How do we embrace our communities? How to embrace their strengths and experiences? Well, we work with all diverse communities. Specifically, we work with Hispanic Latinos. The Hispanic Latinos are a diverse group. If you were not aware, there's 20 Spanish-speaking countries in the world, and we can see a large diverse group of Hispanics in the US. Although the majority of the Hispanic individuals originate in Mexico, we see people from Central America and the Caribbean and South America as well. So that's just a tidbit of how diverse we have our Hispanic community. In 2021, we supported over 1,000 organizations, which with CHW related activities across 48 states and 2 within the US territories. And I'm sorry, I'm a little bit nervous. MHP Salud, CHWs provide nearly 1,000 resource referrals per year to program participants for services such as food assistance, medical services, mental health services, and more. We are really a boots on the ground organization, and that's the nature and the heart of a CHW. So individuals who received health education and support from CHWs, we know that that doubled the amount of daily physical activities, consumption of fruits and vegetables. So there was a lot of areas that CHWs have made a huge impact. In Texas, which holds the highest uninsured rate in the nation, over 5,000 individuals as of 2017 have been enrolled in qualified health plans through our Navigator program. So again, you see these rich relationships within our communities. One of the resources that we are highlighting and we choose to highlight is on cultural norms and caregiving. So we can see that based on the interactions that we've had with our communities, mostly our Hispanic communities, we see the important value of acknowledging the different cultural norms and values when it comes to caregiving. If we could move on to the next slide.
Hi all.
Excuse me? If we could move on to the next slide, please. Okay, so our featured resource is on cultural norms and caregiving. This is a very special resource. We had the opportunity to develop different resources on supporting caregivers, but this specific resource is on cultural norms and caregiving. We thought this was a very important piece because we really took the time to highlight the different values that influences the way caregivers think and make the decisions and how they respond to daily situations on a day-to-day basis. We invite you to explore this resource, and it actually also has wonderful videos that will give you in-depth insight on the day-to-day experiences of Latino and Hispanic caregivers and how we support them in identifying the different areas that we can support and strengthen in their caregiving daily activities and their relationships with older adults. So I invite you to take a look at it, explore it, and we'd love to hear your feedback on that. So thank you very much. I'll go ahead and pass it along to Clayton Fong from NAPCA. Thank you.
Clayton, you're on mute.
I knew that was coming. Clayton Fong with the National Asian Pacific Center on Aging. I'm really pleased to be here representing the organization, but also to be a part of this really important, diverse coalition. There are definitely strengths in numbers. We all share the common goal of advocating for an underserved population. And together, I think we have a lot more clout and power to make a difference. So we're very pleased to be a part of it. About NAPCA. NAPCA has been around for 46 years. We're a national organization with affiliates all around, several hundred affiliates all around the country of Asian community-based organizations that serve. I would say that we're really about figuring out how to provide dignity and quality of life for Asian elders, but what's the core to that? The real challenge for us is the
We're losing your connection a bit, Clayton.
Oh, hang on. Maybe you guys can drop off. It may be a Wi-Fi thing. Hold on a second.
No worries.
Sorry about that. Let's try that again. Maybe a bandwidth issue, an internet connection thing. Anyway, so language access is really the key to reaching our community. There are dozens of communities that come from dozens of countries around. A large percentage of our elders are newcomers to this country. They came here for a better life for their kids. And so English often isn't their first language. As a matter of fact, 70% of Asian Pacific elders speak other than English at home. 50% do not speak English well, and 30% have no one in the household who speaks English. So you can imagine accessing programs and services that are designed to help elders all around the country. Language is a huge structural impediment for them. So what do I want to focus on our signature program around that, and that is our multilingual helpline, Senior Assistance Center. We basically have built in a 24-hour call center that elders can call directly in each language: Chinese, Mandarin, Cantonese, Korean, Vietnamese, and call directly, and they'll get help and assistance in language. No third-party translators required. What's the basis for that is we want to do caregivers up, but if you don't have fundamental access to the basic programs around Medicare, Medicaid, around choosing the right plan, you don't have basic access. Affordable Care Act, all of those kinds of things. So what I wanted to highlight is our activity to kind of relaunch the helpline around open enrollment. So the next slide, please. Next slide, please. There we go. Oh, okay, that's not the one we had in mind. I'll go, on the right-hand side is right. Okay, on the next slide, you'll see on the right-hand side a flyer around open enrollment. So how do we work this? It's really about a combination of doing events. So we
Did we lose them again?
I think, Clayton, I think we lost you again.
Losing me again? All right,
Sorry.
let me try. Maybe it's a directionality of the mic. Usually I'm so loud, everyone can hear me. So it must be the internet. So we did 4 events, and about 300 or 400 elders came to those events. But just as important as the 300 or 400 elders that came to the event, we have a strong network of media partners who cover many of our events on an earned media basis. And so in those 4 events, we generated 2.5 million impressions in various media, electronic and print media. And those media drive phone calls to the call center, which then are able to help individual seniors. And the key to helping individual seniors is not just referring them with information, but to actually solving and helping them all the way through the process. That was so I didn't go over. So bottom line is, we're really proud of this. We look forward to continuing on these areas, and we're really looking forward to taking on the task of vaccine outreach and doing a similar activity in terms of events and really driving the message home that it's necessary to get your vaccine and how often and where and when. So the next, I'd like to introduce Angie Body, who is with NCBA.
Thank you, Clayton. Good afternoon. I'm Angie Body with the National Caucus and Center on Black Aging. Just a little bit about NCBA. We were founded in 1970 to ensure the socioeconomic challenges of African-American older adults were included on the 1971 White House Conference on Aging agenda. Today, these programs include safe and affordable housing, job training and employment opportunity, health and wellness programming, and gerontological research. At NCBA, we work really hard to ensure older adults have the tools and resources that they need to make informed decisions for their lives. Next slide, please. Thank you. Our featured resources are or focus around retirement and income and security. To my left and probably your right, there is a white paper entitled The Benefits of Medicare Advantage for Black Americans. This white paper provides an overview of how Medicare Advantage might meet the specific healthcare needs of Black Americans and across other demographic groups. Next to that report is our demographic report entitled Black and Aging in America. This demographic report presents summaries, statistics, and a perspective on the status of older Black Americans. And to the bottom is Get Your House in Order, an infographic that is part of a series of infographics that we produced during and continue to produce during this COVID season. Get Your House in Order speaks to estate planning during the COVID pandemic. By visiting our website at www.ncba-aging.org, you can view or download any of these resources. Thank you, and I'd like to introduce my colleague, Becky Morgan with the National Indian Council on Aging.
Thank you, Angie. Hi, I'm Becky Owl Morgan. There we go. And I'm Eastern Band Cherokee and Choctaw, and I grew up in Cherokee, North Carolina. I work as the project coordinator for NICOA, and we have our question up there. If you could please take a look. Who are the leaders, tribal and others, in your communities that you can connect with to form diverse partnerships? So please enter your answers at this point. The National Indian Council on Aging, or NICOA, has been around since 1976, and in those 47 years has worked as a tireless advocate to improve the health, social services, and economic well-being of American Indian and Alaska Native elders, and we sometimes call that for short AIANs. Currently, there are 574 federally recognized tribes in the United States. There are over 60 state recognized tribes and countless people who identify as Native, but who do not have ties directly to a tribal community. 78% of AIANs do not live on tribal lands, and that means that many aging professionals may have AIAN elders in their area and not realize it. The last census found in 2020 that there were 9.7 million AIANs alone or in combination with other racial groups. There are 142,972 AIAN veterans in the U.S. Armed Forces. If you find yourself in the District of Columbia, please make a point to visit the National Native American Veterans Memorial outside the National Museum of the American Indian. It's a moving tribute honoring their service. 60% of AIANs live in 11 states: Alaska, Arizona, California, Florida, Michigan, New Mexico, New York, North Carolina, Oklahoma, Texas, and Washington. In 2017, there were over 568,611 American Indians and Alaska Natives aged 65 and over. Next slide, please. And this is our featured resource, which is a curriculum that we designed that has 3 trainings that can be presented together or separately. It's aimed at non-Native aging professionals, and one session is for the elders themselves and the tribal leaders who support them. Caring for Native elders best practices is the first one. And during our process, we decided that all the trainings needed to make clear that Native peoples and elders are the experts of their own experience. Their voices center and ground all our work. Coping with the impact of the past, removal, displacement, termination of tribes, and assimilation can impact elders' health outcomes. Systemic barriers have led to distrust, which can take time to overcome. And so the point of this session is to make a personal connection that can help to build long-term relationships along with culturally affirming care. The second training is called Caring for Native Elders, History and Cultural Traditions. And in this session, participants learn to identify Native cultural traditions, as well as how to utilize key resources to incorporate Native traditions. And that can be added to a practice or an organizational approach. Participants also gain an understanding of the history of Native peoples on the North American continent. And the last training is Caring for Our Wisdom Keepers, Supporting Native Elders. And this workshop points out barriers to elder wellness and brings the voices of elders into the room where they can express their priorities and their insights on how to live a meaningful life. It talks about the importance of respectful, community-based traditional solutions to advocate and support our elders. The training helps to deepen one's understanding of the needs of our elders and helps participants learn how to meet those needs and advocate not only for them, but by their side. Thank you for your time. And next we'll have Cheryl Whalen from SAGE.
Thank you so much, Becky. I'm really excited to be here today. And our question is your organization's non-discrimination policy inclusive of sexual orientation, gender identity, and expression? So we'll take a few minutes and let people answer that question. And this is great to see that 85% of respondents say that yes, their non-discrimination policies are inclusive. 1% said no, and 14% said unsure. And I just want to say that if you're unsure, that's okay. We encourage you to take the time and go back and look at your policies and procedures and see if that information is there. And if not, we have the resources to help you with that. With that, I would just like to share a little bit about SAGE and the National Resource Center on LGBTQ+ aging. SAGE is the largest and oldest organization dedicated to providing advocacy and services to lesbian, gay, bisexual, transgender, and queer elders across the country. We work in partnership with our constituents and allies, and we really have a focus on supporting LGBTQ+ older adults in achieving a high quality of life and provide supports and advocacy for the rights of LGBTQ+ older adults. And we foster a greater understanding of aging in all communities to help promote positive images of LGBTQ+ life in our later years. We oftentimes say that we are the LGBTQ voice within aging circles and the aging voice within our LGBTQ+ circles. And we really couldn't do any of this work without you, each of our partners that are here in the room today. A little bit about what we know about LGBTQ+ aging. 20% of LGBTQ plus people avoid medical care due to fear of discrimination. And oftentimes this is a result of the lived experiences of discrimination and stigma. So we'll avoid seeking preventative care, we'll avoid seeking support for aging services because of that fear of being discriminated against and potentially facing violence. 41% of LGBTQ plus older adults have reported living with a disability. And we also know that due to some of the fear that we experience, that many of our older adults will recloset or hide their sexual orientation and gender identity in order to access services as they age. We also know that many of our older adults are twice as likely to live alone and less likely to have children. These are all concerns when we think about, caregiving supports and connectedness and social isolation, which we also see that 50% of our LGBTQ plus older adults have reported experiencing social isolation. We are a growing population, just like all older adults across this country. We estimate that by 2030, there'll be upwards of 7 million LGBTQ plus older adults across this country. And I think it's really important that, as we hear our presentations today, a buzzword that we oftentimes hear is intersectionality. And what we see with our group of minority TARCs here presenting today is that we represent the intersections of aging across this country. And for all of us to come together and work together, I hope is an example for other aging network providers about how you can also truly embrace intersectionality and equity for our communities. Next slide. So one of the main things that we do through the National Resource Center on LGBTQ plus aging is provide best practices and other educational resources, toolkits, and fact sheets that really help to uplift LGBTQ plus aging. One of our most recent fact sheets is the one that we have displayed here today, Person-Centered Trauma-Informed Care of Transgender Older Adults. This is a toolkit to really help us look at the needs of transgender older adults and make sure that we're providing the care and support that they need to age with the sense of equity and respect as they age. And this is really important for so many of our elders have experienced discrimination and stigma related to their gender identity. And so this guide is there to help us understand to better support our transgender older adults. It's also available in Spanish, and we encourage you to download this guide and use it in your work. Some of the other things that we provide through the National Resource Center include a free of charge training series for ACL-funded organizations. We also provide a number of information, referral, and technical assistance services to LGBTQ plus older adults, their caregivers, as well as the Aging Network. We have our national LGBTQ plus elder hotline that we run in partnership with SAGE and United Way Worldwide. We're averaging around 400 calls a month that come into this hotline from across the country. So these are just a few of the things that we offer through the National Resource Center on LGBTQ plus aging. And if you've not visited our website lately, we hope that you will at lgbtagingcenter.org. And now I believe Greg Link with ACL is going to be joining us.
Hey everyone, this is Greg Link. I'm the director of the Office of Supportive and Caregiver Services. My office and I report to Edwin Walker, who you heard from earlier. And I just want to thank the 5 resource centers as well as the New York Academy of Medicine for really bringing full circle an incredible amount of work that they have accomplished over the past 3 years to advance equity and cultural competence in the aging services network and the services that we provide to older adults and family caregivers. I think it's pretty clear that they have done a lot, but we have a lot more to go. And as we look to the future of, shaping equity and aging programs and services, this is where we need the input and feedback from not only our resource centers, but those of you who are watching and tuning into this meeting, this webinar this afternoon. And so we want to really delve into, in a few minutes of a breakout session, we want to delve into 3 areas around research, or what types of new information are needed about diverse populations. How can we advance the policy ball in terms of better supporting diverse older adult populations and their family caregivers? What are the new policy areas that we need to be exploring? And then finally, the third bucket is how can we advance the practice, or how do we advance and improve our services and supports to diverse older adults and their family caregivers in ways that are culturally competent and linguistically appropriate. So with that in mind, we're going to open up 3 breakout rooms. And all of you are welcome to go into whichever one you want to. One breakout room is on the research question. The second one will be on the policy area, and the third will be on practice. But we're looking for a single answer to this one question in all 3 of those areas. Knowing that we have done a lot over the past 3 years, what are some of the untapped areas of opportunity for growth and enhanced capacity in cultural competency and aging services? And how can we really look at these 3 buckets, research, policy, and practice, in terms of shaping where we go next? So I'm going to leave it to the Zoom wizards to create the breakout rooms, and we will then reconvene after that to have a brief report out of some of the high-level topics that were discussed during those breakouts. So Mario, or whoever is doing the breakouts, take it away.
Perfect. So as Greg had mentioned, we'll have these 3 options. It's a self-select. You can go into either of the 3 categories that you would wish. On the other side, you'll meet a pair of OAEC representatives who will lead the discussion and record some notes from the discussion for the report back portion in about 10 minutes. So we hope you enjoy a robust discussion, again, on this guiding question: what are the untapped areas of opportunity for growth and enhanced capacity? So let's launch those breakout groups. Out here as well. So I'm going to kick it over to our first group, Cheryl and Becky, for the research and knowledge development. Just to share a summary of some of the discussions, kind of how your conversations went.
Cheryl, do you want me to just kind of summarize and jump
Yeah,
in?
feel free.
Well, our first comment was to do with the problems of elder Black English-speaking populations that felt left out, trying to deal with worse health outcomes, and inheriting the history, the trauma of slavery and what that can bring. This person was saying that religion was something that people should take a look at. And this person was a physician, and so she's saying that the negativity seen in medical charts is a big a sign of a problem. The term non-compliance is code, I guess, for lots of different things that people express. And so she's thinking that the health tools need to be looked at more closely, and hospitals can play a part to get rid of the negative terminology. And then the next person echoed that and talked about institutional racism, and on family caregiving, how cultural competency can really be helpful. A language is an issue. Bringing focus groups to the inner cities would be helpful, and do a better job of reaching people, because how can we know what their needs are if we don't ask people what their needs are? Another person was saying rural needs are forgotten. They're inaccessible, and people are unaware of the resources. Transportation is a problem. And then just when we were getting to Holly, she got cut off. So I'm hoping that she could be able to unmute and jump in.
Yeah, we'd love to hear, Holly.
Oh, thank you. Thank you. The group was great. I'll just briefly say, yeah, we were echoing the rural discussion about, as research and knowledge development is seeing the trends and outcomes in the data for rural areas, there's just this professionalization and funding going into rural areas, but that might not be participatory or representative. And so how are we making sure that all these national and even regional efforts are still local to the people who the services are designed to reach?
That's a very important consideration to maintain participatory action in all of this research, that it's not just, you know, what do they say, parachuting in with a solution. Were there any other ideas that, due to the time constraint that you didn't get to share for the research group?
This is Lucille Joel. I don't know if you can hear me.
Yeah, crystal clear.
Okay. I'm an advanced practice nurse, and I'm based in Newark and New Brunswick, New Jersey. I'm faculty at Rutgers University. And I do lay hands with people. I take care of patients, many who are from the Black community. And I see two areas where we need more research and investigation is education and autonomy. We don't know what they know about their medications. That's critical. And also, they are in charge of their own medication regimen and in charge of their care. I am sick of the medical community thinking they know better and they can dictate to patients. The first thing I ask my patients is, what do you know about the medication you're taking? And if you need help, who do you want? Family is not always the choice. I had one patient last week who told me he wanted his bartender to help him. That was his best friend. So I contacted the bartender, and he was more than willing to take on that responsibility.
Thank you, Lucille. No, those are all very important considerations.
In favor of time, I have much more to say, but that will be it for now.
Absolutely. No, those are, it's very important to bear all of that in mind. What I'd like to do is hop over to our group 2, the policy discussion. If we can get a quick summary on how that conversation unfolded.
Hi, yes, this is Monica. We had a lot of rich conversations regards to policy. One of the areas that was brought up was to have more policies that support diverse family structures because of the many multi-generational households. We also were looking for more access to language, to identify how they can help have more support for the diverse languages that are available. Sometimes care management or care coordination, the material is not written in the language that is needed. They were also brought up on policies on what's going to happen now that the Medicaid eligibility is winding down due to the CARES Act. What's going to happen to individuals that are not able to either self-renew or have access to the resources to do so. And authorizing the basic income for individuals. So if there was a lot more that we wanted to discuss, but we ran out of time. So if I missed anything, please feel free to add. Anyone from the group?
Yeah, we'd love to hear any loose ends that didn't get to get tied up. I see Terry White's hand is up. Go ahead, Terry. You're on mute. There we go.
Yes. Hi. Wanted to one of the things I was going to share just in general, because of time, is if we could participate more in health fairs across the country, to think that health fairs are not just physical, so that we can have these conversations around caregiving, around advanced directives, talk to the different minority groups, and just not think of health fairs as for physical health, where someone just comes to take your blood pressure and things like that. I think we also need to, as organizations, need to broaden our lens on how we can get information out there.
That's a fabulous idea. Anyone else from the policy breakout group? Any other thoughts that you'd like to air out here?
This is Catherine Kim. I put it in the chat, but I'm just going to read it out loud from New York City Department for the Aging. So just more research or communication and policy to address how to support the increasing rise of low-income senior quote unquote orphans who do not have any support networks, and planning for the increased needs for their services, and who are concerned about their declining capacity to dictate their own plans for care. This is definitely an issue, not just general community, but certainly for our diverse communities. The second thing I was going to say was also considering the home health aid crisis, with the mass exodus of people leaving the community, more support and outreach for recruiting and supporting clients with different cultural needs, for example, dietary concerns or language issues that may arise, because it's even harder to actually get someone who is culturally competent and get them matched. Thank you.
Absolutely. No, thank you for sharing that. All right, with an eye on time, let's kick it over to our third group, the practice breakout group, for a quick summary. Yep, go ahead.
Sure, Mario. In addition to Greg's question, we asked, what aspects of working with older adults do you think have been overlooked, and what supports could you imagine being helpful in addressing them? And I'll turn it over to Angela just to provide some feedback on that.
Yes. Thank you, Angie. In answer to that question, one of the areas being overlooked was managing medications properly for older adults. It was noted that many older adults are on various types of medication, and the ability to manage it, could be difficult. So even pharmacists could spend some more time with older adults in assisting them to do so, and to finalize more support from home and community services to help older adults manage their meds. Another is to increase services for older adults in the deaf community. Also, I mentioned was a more streamlined information on how to enter or re-enter, as a matter of fact, re-enter the workforce as an older adult. Also needing with some services to access the homebound, more services needed to access for the homebound, and also allowing opportunities for intergenerational communication, since the information is being garnered from every generation, to ensure that our older adults, the generation of older adults, receiving communication as well. And lastly, there was making services work together for those outside the regulations of the cities, or even into the rural areas. So making services more accessible to those in rural areas. And that's what I have, pretty much. Again, I apologize if there's anything that I missed. Thank you.
Yeah, no worries. And so same goes for the practice group. If there's anything that a member didn't get an opportunity to share, we'd love to air those out here.
If I may make a comment, my name is John Imhoff. I was a former DSS commissioner and currently working with a number of geriatric patients and their caregivers. I'm very concerned about the growing numbers of caregivers who, because of, for example, the CDPAP program, can easily sign on to provide care for the frail elderly. But I am concerned about the absence of sufficient training for this group. And I'm wondering if any of the groups that spoke today have any interest in, if they could forward some information about their programs or how they try to develop training or education for non-home healthcare caregivers, and to find out if anyone has heard of or interested in a certification program that might be developed or has been developed for caregivers. So thank you very much.
A great question. I'll open that up to the any of the TARCs. Again, for this consumer-directed personal assistance program, any types of trainings that you've offered, any of have the TARCs worked in any capacity with training non-professional caregivers for CDPAP programs?
Right.
And they're often called different names in different states. But whatever the program is where you can pay a family caregiver to provide that caregiving. And Terry said that New York City actually has free programs to provide that training.
Elaine, I'll try to get you a link.
That would
I
be great.
see some every now and then. I do know that VNS, Visiting Nurse Services of New York, which is now VNS Health, and they also were providing training. There's a place in Sunnyside, that Sunnyside Center, they provide training. Care and Kind provides training for the Alzheimer's, for caregivers, so that they can get Alzheimer's training. The Stroke Association provides specific training for people who are experiencing strokes. So there are some things out there. It's just not in one place. That's part of the challenge.
Right. So if anyone, John or anyone else wants to email us, I put both mine and Mario's email address, and we're happy to follow up and do some additional research. And thank you, Terry. Those are all good suggestions.
Thank you, Alana.
Yeah, absolutely.
I'm sure a lot of the programs that were even mentioned earlier in the TARC presentations, that the information there can be kind of drawn into the CDPAP model, that training caregivers, regardless of if they're professional or non-professional caregivers, that there would be valuable information that I imagine could be adapted for that particular circumstance. Any other thoughts? We can even open it up to the research policy and practice, to all three, before we start to close things out. Moverine, is your hand up? I see the...
I'm sorry.
Yeah, no problem. I saw your microphone light up.
Oh, it did. Oh, I don't know why.
No worries.
Yeah.
All right, so with that, I think we can start to wrap things up then. I'll just go to our final slide there.
No, we do have one hand up. Miss Aubrey.
Oh, I missed one.
Yep.
Yeah, go for it.
I was just wondering, you know, all of you guys are in all different kinds of areas. Are there any person-centered care going on in your organizations?
I know that SAGE has a number of resources in our resource library that that address explicitly that need of person-centered care. I don't know if Cheryl, if you'd want to talk a little bit more in depth about that.
Yeah.
Yeah, I'd be happy to share more information. One of the resources we shared today was on person-centered care, supporting transgender older adults, and we are, you know, on some committees and other opportunities to help support person-centered care across our communities.
Yeah. If it's possible, I just wanted to add a statement. I'm trying to see what happened. Yeah.
It's good to see you, Dr. Marbury.
Yes, just a quick statement I want to make. Sometimes we have an opinion of what we think patients want, and then it's not the reality. So I think it's important to look at perception reality. I'll give a quick question. Asked staff, why don't patients take their medication? And everybody said nurses, social workers, nurses, doctors in the ED and in the emergency and in the inpatient, cost or side effects. And that makes sense. But when you ask the patient in the bed, why didn't you take your medication? And these were heart failure patients, so it's age related. And no one mentioned cost. No one mentioned side effects. Guess what they said? We don't take our medications because we think we're taking too many medications. So these are the people in the bed that we don't usually get their feedback. We assume that cost, and if you design a system around cost, the health outcomes is going to go south. So we had to bring in a pharmacist to look at all the medication and see if she could cut down any of the medications. And that changed the readmission data. It was a big contributor to move into congestive heart failure readmission from 30% to 18.7 in just about two years. And so the patient story, the patient voices, it was so pivotal. So when I did a survey with staff,
Absolutely.
I asked the patient the same question. And there was never, most of the survey, the responses were different. Okay, I just wanted
thank
to
you so
share
much
that.
for sharing that. No, because
Yeah.
that's right on the money with the value of person-centered care. So thank you for augmenting that. So with an eye on time, I would like to just address some thank yous, and we can wrap things up. Just a big thank you to the OAEC members for working so hard on putting all this together, to NAPCA, NICOA, SAGE, MHP Salud, NCBA. A big thank you to Edwin Walker at ACL, along with Greg Link and Nicole Becerra, also at ACL, who've been on this journey for a while with us. We really appreciate that. And ultimately, thanks to all of you for getting involved in this, for sharing all your thoughts and helping us to imagine what this future can look like as we aim to make a more equitable life here for older adults. So thank you very much. I encourage you to follow up at any of these email addresses you see there. And most importantly, go check out the resource library. Just click around, find some interesting information. And wishing you all a lovely night.